Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right. Carlos, tell me what's going on with your clavicle. What happened?
So I fell off my bike about 2 months ago. I broke my clavicle, got broken from the ball joint.
Okay.
So
you fractured in here where they had the surgery?
Right where it's connected to the ball joint.
Oh, wow.
Yeah, right where it broke from the ball joint up like that.
Oh, not in the middle?
No, it's from the ball joint to the actual, And I just got surgery done 2 weeks ago.
2 weeks ago.
Yeah.
All right, so can you give me an update how much pain now from 0 to 10 when you move your shoulder?
When I try to move my shoulder, it's about 3 to 4, depending on what I'm trying to do, the movement, if I'm carrying stuff, which I'm trying not to. As far as just not doing anything, the pain, maybe a 1 or 2, depending. Sometimes once in a while I get muscle spasms.
How much muscle spasms do you get that?
I probably get them maybe 2-3 times a day, and it just gets.
Which muscle did it start to spasm?
It's right here, and then right here.
Okay.
My.
So at worst 3 to 4, is that what you're saying?
Yeah.
Okay, that's not bad.
Yeah,
actually.
but it's
that's
not like painful where you're saying you can't tolerate it.
So you had you fractured 2 months ago. You had the surgery on the 25th.
Yes, sir.
So that's mean like 3 weeks ago.
It's gonna be 3 weeks this Wednesday.
This Wednesday.
Yeah, 3
okay.
weeks this Wednesday.
So we're gonna see your range of motion and let me know how much pain with that range of motion. Okay.
Okay.
So let's actually do this.
Do this.
Yeah. So you see how far he can go? It's just very limited, and he compensated this way by tilting.
Yeah.
Get the front.
I'm tilting.
Yeah, I will not do that. Just to look straight. Okay. So that's very tight. It's very typical after clavicle fracture. You know, we have to do rehab because a lot of tightness, a lot of scar tissue. We need to release it. That's in the way. Let's do the side. You can stand up and do the side. Thumb up and bring it to the side.
Like this?
Yeah.
Like that?
Well,
like this?
Yes, like this. This is good. Yeah. You see he's compensating too. He's very limited with the range of motion. So I will have you lie on your back. I will measure your range of motion. We'll work on it and then we'll do it.
Okay.
We'll measure again. Head here.
So head here?
Yes, on your back.
On my back.
So when you fractured, it was actually sticking out your clavicle.
Yeah.
That's painful to watch, actually.
What, like you can see it over this. It didn't go through the skin.
It did not go through the skin.
But you can see the bump.
Oh, so you did not cut your skin. You just man, that was not fun.
Yeah, that was a good gnarly break.
Oh my goodness, I can't believe that's. It's.
I was saving some puppies that were drowning. So.
You did save them?
Yeah, I saved them.
Okay. Well, you're a good man. Okay. All right. So let's do the flexion. Bring up. I gotta do it for you. Okay. No, just to stay in the same position. Okay. Okay. Let's do the flexion. Okay. So he's basically actually 10 degrees here flexion. Okay. Sorry. Make sure what I'm doing is not painful.
No, it's okay.
That's 10 degrees flexion, okay? We're gonna do the abduction from the top, okay? Can you bring your arm like this way? That's okay. And this is, okay, you can see this, 45 degrees. 45 degrees abduction. So flexion, 10 degrees. How much pain from 0 to 10? I'm sorry.
It's about 4 or 5.
Okay. We don't want to push it, okay? Stop when you feel pain, okay? Sorry. So, we're going to do external rotation. Can you bring it back? This way. Okay. External rotation, this is 15 degrees. You see this? 15 degrees. Okay? Internal rotation, bring it this way. And internal rotation is 50 degrees. So 15 I said, and 50. Okay. All right. It didn't feel cold, you okay? I think we have pillows here for his. Comfortable in this position?
Yeah.
So I'm losing up the tie. Oh, wow. Sorry. Is that painful? Okay.
A little bit of that.
Okay. Make sure this is not painful. Was it a regular bike or a motorcycle?
Regular bike, cycling.
Oh, man.
Yeah. Slam on my brakes and I hit the front brake, flipped over.
Oh, my God. Well, you're lucky you did not hit your head, did you?
I did, but I was wearing my helmet.
Oh, that's good. Okay, so you did not have concussion?
No.
Mm-hmm.
Luckily, I got him to come up with the helmet for the shoulder.
You're lucky that you did not have traumatic brain injury. That's or spinal cord.
I hit
injury.
that first.
Your head?
Yeah, when I
so
hit my
you
head.
flipped over?
I flipped over when I hit my head first. I was like, oh, these helmets work. And then my shoulder hit and I was like, oh, that didn't work.
Oh, so you flipped, hit the
head first, rolled over.
And landed your whole body. Wow, so your body flew?
Yeah, I was going about 22 miles per hour.
Ooh,
so I tried to stop and...
That's not, oh wow, that's not easy. Oh wow. You can...
It was gnarly, that's fine.
Yeah. Well, it's miracle that just get on to the clavicle only.
That's.
Yeah.
I'm glad that's the only thing that happened.
That's the only thing. This is the easiest thing, actually.
Is it? Good.
Well, compared to like traumatic brain injury or spinal cord injury, that's disability. You know what I mean? With a lot of, like some patient could get disability from that. But this is, less.
It's if something was gonna happen, this is better, right? Because
Yes, this is better than other
stuff,
things. Yeah. So, okay, no bike for now. Okay.
Yeah, I know.
Put hold on that. Okay. So the bike. So you had a lot of bruises here, yeah?
Yeah.
Sure. Okay. Okay. So I'm gonna work on the scar tissue. Make sure this is not painful, okay? You're gonna feel cold, okay? So I'm gonna show you the scar tissue here. Oh, you made a mess here. Okay. You feel this bump here?
Yeah.
Is that painful?
A little bit.
Okay, sorry. That's a scar tissue. You feel that bump?
Yeah.
Okay, let me show you another area. You feel how nice and smooth here?
Yeah.
Okay. And this.
Oh yeah.
That's a lot of scar tissue. Mm-hmm. Do you want to feel it or are you okay? Okay.
She's felt it.
Yeah. So it's a lot of scar tissue here in this area. You feel that?
Yeah.
I'm not really surprised that because from this fall you had a lot of tears everywhere.
Yeah.
And when you have tear, like any cut, your body has to build a scar tissue to close.
To protect it, yeah.
To glue it together, like when you have a crack in the wall, you put cement to really bind it together. The same thing, our body has to have that cement, that glue, and that's the scar tissue. So the problem is when you have too much cement, it's similar to, the muscle should act like a rubber band. When you contract and relax, it does this. When you have too much scar tissue, it's like a knot in the rubber band.
That's like it.
So when the muscle contract, it does not stretch much. So you start to lose range of motion.
That makes sense.
But here's another thing. You had surgery. Your body has to build a scar tissue after the surgery. So we have to, when it's healed, we have to really work around that scar tissue from the surgery so you can move freely.
Help the muscles around.
Yeah, so because you don't want to have those rocks everywhere that's in the way of the joint, of the muscle to move. So it's a very typical, we just have to break it down just to get you the range of motion. Is that too much?
That's good.
Okay, we'll have you sit up actually. I will work on the side here. So the mask here. Wow. I'm insisting on dropping some lotion everywhere. Is that painful?
No, it's just I'm just sensitive because I know that I got surgery, so
guarded.
You know what I mean? Yeah.
Yeah, I don't want
But
to.
it doesn't hurt.
It's
It doesn't
emotional.
hurt. It's just.
Is it okay to move that? Or?
It's just
Yeah.
like being a little.
Just guarded, yeah. As long as you don't feel pain, it's okay. Okay,
No,
but I'm not gonna get to the surgical side. Okay,
No.
I will just work around it just to make sure everything else is loose, because the range of motion is very limited. Look up nice and tall. No, just sit up nice and tall. Good. Okay, is that painful here? You feel that scar tissue here? Those bump?
Yeah.
Make sure it's not painful, okay?
No, not painful. It's just.
Did you injure anything else?
No, that was it. My ego.
Oh man.
Yeah.
That's rough.
That was the toughest one. I can't put a cast on that one.
No. All right. Which one? To feel those bump here.
Yeah.
And you were wearing sling.
Yeah, I was wearing a sling for many months, so that.
So your elbow gets stiff.
Oh, my elbow's killing me. But I have to keep stretching and moving it all the time. So I could do this, no problem.
Straight it as far as you can. Oh, that's not bad. Okay.
Yeah,
that's not bad. Yeah, I had some patient actually from the sling. They did not do any exercises, or they just did it for a long time. Their elbow came like this.
Oh, really?
No movement.
No, I would take
like
the
even
sling
though the
off
doctor told them to do some motion in the elbow, and they did not do it. I'm like, now we're gonna work on the elbow and the shoulder.
Now you got both problems.
Yeah, so that's make it more, more work to do. Yeah, but I want you to continue working on your elbow.
Okay. Just do it like motion.
We're gonna give you more exercises after I finish. You feel that?
Yeah.
That grinding here?
Yeah.
That's scar tissue. Yeah. Make sure it's not too much. Make sure it's not painful, okay? Is it painful? It's okay.
No, it's just me being.
Just sit up nice and tall. Well, the good news, you're smiling even you're in pain, so.
That's
make it easy. It make it easy to work with you.
It makes it easier, yeah.
But make sure it's not painful. You feel all of that? Okay. So again.
And it's pain, but it's tolerable,
Yo,
It's not
I do
like
want
so much pain.
I don't want to cause pain, okay? Because there is fine line between causing a scar tissue and breaking scar tissue. If you feel pain, we might cause trauma to the healthy tissue. We want to make sure we're really not crossing that line, okay? Is that painful? It's okay. Tickles. It's fun to be here,
Yeah, you get tickled at the same time.
Yeah, well, it comes free with the treatment.
There you go.
I had a patient that was so ticklish that laughing very loud. You can hear him in the waiting room. I'm like, it's extremely fun to be here.
You gotta maintain a positive attitude.
Yeah.
It'll heal better in your body.
That's correct. Sorry, I get emotional everywhere. Okay, I'm gonna do a couple of things with my hand. Make sure it's not painful. Okay. Okay. Relax. Say something, okay?
No,
Or just guard it?
I just felt the moan kind of move a little bit. I felt like something adjusted when you pressed it.
Yeah.
It doesn't hurt though.
Okay, as long as you don't feel pain.
Just because I know I got the surgery on.
Yeah, it's normal to be guarded.
Yeah.
Actually, this is a protective mechanism. Your brain has to do that. It's just a survival. What I'm doing, make sure, I'm just very gentle, but make sure if you feel any pain, let me know.
Okay.
Because I want to lose I know, I don't expect we'll get full range of motion today.
Okay.
Because the amount of scar tissue and you're just fresh out of the surgery. But I want to get as much pain-free as possible range of motion. So we'll see how far we can go with that, okay? You can come in the front. Too much? How does feel what I'm doing here?
I'm good.
So he put just one screw. That's beautiful. That's actually better than putting too much.
Yeah, he was talking about a couple of screws, but when he saw the X-rays, like, no, one screw should
one
be
screw
fine.
should be good. Yeah.
You
Don't
don't
do
want-
any lifting. You know, just do the exercise again I gave you, but no lifting. Okay. Is that too much?
I wanted to.
Sorry. Okay. What about this?
That's fine.
Okay. Can you tell when I start to release it?
Yeah.
Okay. Sorry.
Yeah, that's very sore in this area.
But can you feel the tightness?
Yeah.
It's my hand.
Yeah, I can feel the bone, the tightness in my arm myself.
So I'm just doing deep release to make sure it's not painful. Okay, let's see the range of motion flexion. Let's do the front. How's that?
Oh, a lot better.
Yeah,
I don't
you're
have
going
to.
further.
I don't have to. Yeah.
Let's do the side. No, it's just the same position, but go to the side like this. Okay, where do you feel the tightness now?
Right here.
Right in here?
Yeah, like right here.
Okay. Sorry, I got some lotion in your shorts.
It's okay.
So you're gonna remember me when you get home.
We'll watch it.
Okay, so let's actually, we'll have you sit here. Sorry. No, just facing this way. Let me know if it's too much. Okay, it's look like aggressive what I'm doing, but it's very gentle. You know? Hmm?
Yeah, feels good.
It feels good,
Yeah.
you know? And I feel good too. Alright, is that too much? Okay, so I'm actually trying to release the tightness. He had surgery, so we really have to be very gentle, you know? Just doing the release, but we try to be sensitive with the healing process, you know? We don't want to really irritate inflamed area. It's similar to like you have a cut and you don't want to stab that cut.
Should I keep icing my shoulder?
You know, ice temporarily
Yeah.
decrease inflammation.
Okay.
You know, we're gonna go over more effective stuff for inflammation after, you know, after I finish the manual stuff. But I just wanna see how far we can gain range of motion, because that range of motion, that's, you know, as long as the inflammation under control, you will be able to do more exercise. Because if you come here and I'm just, let's do the exercise without the release,
Yeah.
you're not gonna,
You have to
Get-
release.
I have to release it, and then afterward, I will give you the exercise, and you're like, yeah, I can move it. Too much? Okay. Make sure it's not too much, okay? Feel the mobility now?
Yeah.
Feel the movement here? You see that? Yeah. And I'm just gonna do more release here. Okay. Too much or it's okay? Sorry. You feel that clicking?
Yeah, the popping, yeah.
That was scar tissue.
Is that what that is?
Yeah, because the scar tissue is like a rock. When you
Ah.
move around it, it just keep like
Moving around.
yeah. So it's,
And
and
that work.
then we get to that that scar tissue we leave there. But I want to make sure at least we clean up around it so we can get more range of motion. Front, thumb up when you do that. Nice and tall. Okay. Beautiful. Let's do the side. How's that?
Better.
Any pain?
No, just turn a little bit.
Yeah. Okay. Let's lie in your back, and I'm gonna take your range of motion again.
Okay.
Because I get the motion. So let's lie in your back. So let's actually get the range of motion now. Okay. So flexion was 10 degrees. Let's actually thumb up and elbow straight and really bring it up, straight up. So that was 10 degrees initially, and now is, 1 second, it's 50 degrees, 50. 10 degrees, now it's 50 degrees, 50. Okay. Abduction was 45 degrees, so you're gonna make sure your elbow straight, okay? We're gonna get it from the top, and let's get to the side. That was 45 degrees. Let's see how much is now. is 60 degrees. Can you see that? 60 degrees. 45, now it's 60 degrees. Okay. External rotation was 15 degrees. We're going to do it this way. That was 15 degrees. Let's bring it back this way. 15 degrees. Let's see. Okay, now it's 20. Let's see. There you go. It's almost like 26 degrees. 26 degrees with 15. Relax. 26. Internal rotation was 50. 50. Let's try it now. Is that painful? It's okay. So internal rotation was 50. Now lower it down. Okay. That is. That's 60 degrees. Can you see that? 60 degrees. It was 50. Now it's 60 degrees. Set up for me. So flexion was 10 degrees. Now it's 50. 40 degrees extra. Abduction was 45, now it's 60. I'm gonna get a front view. Yeah. And external rotation was 15 degrees, now it's 26, like almost 10 degrees. External rotation was 50, now it's 60, 10 degrees. So let me see your range of motion now, up. Can you see the difference? Before you could, you were doing this. Yeah, let's do the abduction. I'm not expecting to get a full range of motion today because we have a lot to work on, and I'm not able to work in here because you're still healing. Yeah. So that's my limitation. Let's do the abduction this way. Okay. Yeah. So let's move. Yeah.
Yeah, can I move that?
Yeah. So what do you think about the treatment, ASTR treatment, what we just did for
I like it.
Second?
It
Yeah.
feels like it's working. Yeah. It's really helping. Yeah. It's not painful.
Okay, so gentle.
Yeah, gentle.
Yeah,
and I'll be able to do the range.
Yeah. So you're able to move it around. Yeah. Awesome. Yeah. Thank you.
Start lifting weights soon.
Oh, not soon. Okay, we're working on it. Okay. Yeah. We're working on it. Thank you so much.
All right. Thank you.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.